Now, good afternoon, Mr. Dunlop. Can you hear me?
Yes, I can, Lord.
Very good. Thank you. And good afternoon, Miss Henderson as well. I'm ready to go when you are, Mr. Dunlop.
Thank you. The witness this afternoon is Ms. Ruth Hendery, and for the benefit of your Lordship's notes, the witness number is SCI WT 0451, and then 5 zeros and a 1. Thank you. Good afternoon, Ms. Hendery. I wonder if you can provide the inquiry with your full name, please.
Ruth Hendery.
Thank you. And when you're giving evidence today, can I remind you to try and avoid naming any individuals?
Yes.
Thank you. You've provided a statement to the inquiry, and we have that in front of us. That's taken as your evidence. I wonder if we could look at certain passages at it. We see before you retired, you worked as a head teacher with children with special needs. Is that correct?
That's correct, yes.
Okay. And in paragraph 3 of your statement, you tell us that you've previously used the services of Voices of Carers across Lothian, which I'll refer to as Vocal, which I think is...
Yes, Vocal.
More recently, you've joined the board of Vocal, and that was in 2020, but just before the pandemic, is that correct?
I had one meeting before we went into lockdown.
I wonder if you can tell us, what is Vocal?
Vocal is a carer support organisation that covers Edinburgh, the City of Edinburgh, and Midlothian. So it's working with both local authorities, both of whom are within NHS Lothian, to support carers in whatever way they can.
And you say in whatever way, could you give us some examples?
Yes, certainly. A big part of the work is answering the phone to people with queries. So it's giving information, it's giving guidance, signposting to other services. We have our own services like counselling services. We would facilitate setting up self-help groups. We would run group work. We offer training, particularly to employers. We work extensively now with employers to make life easier for the carers they might employ. And we administer with funding that often comes one way or the other from the Scottish Government to support carers with micro grants for food and fuel or for short breaks. And indeed, it's the area of short breaks, respite, that is something we've been expanding more recently.
Okay, I'll maybe ask you some questions about the short breaks. In terms of as an organisation, is it wholly volunteer run, or does it have a paid workforce?
It has a paid workforce that has grown as the responsibilities given to Vocal have grown, but it does have a number of volunteers, and most recently we've taken on a volunteer coordinator to build up the number and the roles that can be played by volunteers.
And in terms of, just in brief terms, full-time equivalent employees, how many, do you know how many employees, roughly?
I think it's about 70 full-time equivalents.
And in terms of, is there a membership or such? I mean, we've heard from various organisations, you know, that have almost a register of members. Is there a membership, or is it more like a citizen advice bureau where somebody can just walk in off the street and ask for help?
It has been historically an organisation where people can walk in off the street and ask for help. We have encouraged GP practices, health and social care organisations to the partnerships to refer people to us. So we get a lot of referrals through other folk, but it has been self-referrals too. We are reviewing our articles, and we will have membership because we have a list of people to whom we send newsletters and who are regularly engaging with us.
And can I ask, is it only unpaid carers that Vocal assists, or is it all forms of carers, even paid carers?
Obviously, we don't turn anybody away if they come for information and guidance, no, but it's for unpaid carers because they're the ones who have not got any other form of support historically.
Okay. And in your statement at paragraph 15, you tell us about the funding of vocal, and we don't need to look at that. We have that before us. And paragraph 16, you tell us about services such as guidance, counselling and short breaks. I wonder, just for the purposes of the pandemic, can you tell us a bit about what the short breaks were and whether those were affected by the pandemic?
Absolutely. Before pre-pandemic days, needs would be assessed by social work staff, and families looking after the people they cared for would often be given an allowance according to need of what we used to call respite, because it really was only people who had very high level needs and who were seen to be in most need of breaks from caring. Now, this was meant to, I can remember when it was my son's case, it was given to me that both he was getting to an age and stage where it would be quite natural for him not to always be at home, but to have a break from home. But for us as a family, it was absolutely essential to get a break so that we could work with our other kids, do stuff that ordinary families do. But breaks from caring have become the new way of looking at what we did call respite. They don't like the word respite because it suggests you're getting away from something bad. And it would be very nice to think that these short breaks were all wonderful, positive experiences. But the bottom line is, for a lot of unpaid carers, getting those breaks are what sustains them, what brings them the capacity to come back and carry on caring. And it is getting away from a lot of very hard work, a great deal of responsibility. But short breaks is now what we have been encouraged to call, there are funding trails that allow us to offer carers breaks from caring. Quite often it happens that if, for instance, in the case of vocal, we now have a property and we've just acquired a couple of caravans that people want to take the cared for person with them, because that really is, if you've got if you're looking after somebody with very complex needs, that is often the only way you can get a break from normal routine. So it covers a wide range of different scenarios, but it is a break from normal routine.
I wonder if I could just briefly ask you a couple of sort of follow-up questions. And you said that there was an allowance assessed. Is that allowance a number of days a year? Is that?
Yes, it would have been.
Right.
Yes.
And in terms of that allowance, is it if the person who's being cared for has more complex needs, I think as you put it, do you get a greater allowance? Is that essentially the way it works? And I know there's no such thing as an average person, but just to put it into context, in terms of how much short breaks, formerly respite, someone would expect to get in a year, I mean, is it 2 weeks a year? Is it 2 months a year? Can you just put it in context?
Certainly in the school I was at, and my own experience, it used to come out at about 35 nights a year. I knew one family who had 72 nights, and that was because they were on their knees and their son was particularly complex. I must add that all these assessed needs and the allowance of respite all stopped dead when COVID arrived, and all services just stopped, and these have not come back.
Okay. Well, let's deal with the pandemic first, and you can perhaps explain why they haven't come back. You say that they stopped dead, so you mentioned that there was with vocal, you said that there was a property, and I'll call that a holiday cottage type.
Yes, it is exactly that. Now, this is a service that is post-COVID. I'm sorry, I maybe didn't make that clear. Previously, the local authority had worked in partnership with a number of providers, often charitable organisations, who would provide the location and the staff for respite breaks, and it was your social worker would give you the allowance and they would manage the funding. So basically, as a family, we were told, take your young person, or in fact they often went directly from school. So it was a service that was built into the other services that they were getting at the time. As a child and as an adult, it would be something perhaps in a care home or some such that, again, you'd have an allowance. You'd know you had that allowance, but the local authority, your social worker, would actually organise it, and it would include transport.
And we know that you're a director of Vocal, but you've talked about your son, and again, without please naming any names, am I correct that you've used the services of Vocal prior to being a director because of your son's needs?
No, it was actually once I was a board member,
Right.
I realised the opportunity was there to use their various services. But I certainly knew, I'd done a bit of work with Citizens Advice, and certainly at the school, I knew that it was well worth signposting people who had concerns.
And as you've got two hats essentially, and perhaps more, as a parent with a son with needs, and obviously as a director of Vocal, can you tell us, or can you tell the inquiry, what the impact was in relation to both the person being cared for and the carer of this respite coming to, short breaks coming to an end during the pandemic?
Well, it was devastating. I mean, personally, my son was, by that time, we had been advised to get him into a residential establishment because the money was running out for such moves in terms of adult services. But for many, many carers who absolutely depended on getting breaks in order to sustain themselves, the other members of the family, to have suddenly that just shut down for years, it was just, it brought a lot of carers to the edge, the brink.
And do you know if it had any impact on carers' mental or physical health?
Absolutely, both. I mean, I know people directly, but I know Vocal, through their survey, has identified people who had to say, if I can't get replacement care for the person I'm looking after, as in a break, where I'm not the one that's looking after them, how can I have this operation? And that happened to many people. They put off treatment, they put off operations, they did not look after their own health because they couldn't get a break in order to have the peace of mind to know that their individual, the cared for person, was being looked after.
In your opinion, could things have been done differently? Could respite have, short breaks, could that have survived the pandemic? Could that have been executed in a different way?
Yes, I believe it could have done. There were self-directed payments could have been much more flexibly used, because that was a big issue, that you were not allowed to use other family members. You were not allowed to pay other family members to do any of the caring. So if you had an extended family that included people that knew your person and could have looked after them and let you do, get a break, you were not allowed to use that funding in many cases. And that lack of flexibility, I really feel, should be looked at.
Can we talk about that? Can you tell us what are self-directed payments?
Self-directed payments are the mechanism by which the Health and Social Care Partnership, having made an assessment of an individual's needs, then attach funding. And it can be for day services, respite services, replacement care. And it's meant to be the means by which families can either say, right, I'll find a carer to look after them, or I'll find an organisation that you can pay. There are options, but the idea is it's the funding mechanism by which unpaid carers can be funded to, or rather the cared for person can have services that are paid for by the partnership.
And you said there was a lack of flexibility, which suggested there was some sort of ring fencing. Am I? No.
Wasn't quite as like that. It was more, the Scottish Government asked, as we understand it, the Scottish Government asked partnerships to be more flexible. But the snag was that, coupled with COVID, we had also had years of austerity, never mind Brexit, shortening the supply of carers, paid carers. So what has happened is that there was a pressure not to be as flexible as might have been with these funds, because what's happening now is where they are unspent, because a family couldn't find a carer, couldn't find an organisation, couldn't fund family, then the partnership takes the money back. And as we know, the partnership's short of funds.
In terms of, I think the question asked, could it have been done differently? And I think you said if there'd been more flexibility in these self-directed payments. So what, if you were in charge, what would you do?
Well, there can be safeguards in terms of knowing people who are going to be in receipt of payment for care, so that you're not just leaving it for Tom, Dick and Harry to do this. In the same way as childminding, you have sort of safeguards. It could have been more flexible to allow in extremis family members to do more, other family members, not necessarily the direct, say, parents looking after. And there were some constraints on that. I think in some cases push came to shove and it was accepted. But I know carers who have tried to find PAs, personal assistants, and they've simply come up against the buffers. And another flexibility is there's a limit how much you're allowed to pay per hour if you're using these funds.
If the funds, if the funds were paid to the carer, I'm struggling to understand how that would have enabled short breaks to have occurred, because I appreciate perhaps there would have been hotels open in the north of Scotland, but that still would be the same carer and the same person being cared for. Am I missing something here?
It could have allowed the wider family, for instance,
right,
or friends or neighbours or other people who knew the person, i.e. could work with them, whether they were, if they were a bit, you know, if they had complex. And that could have been replacement care, allowing the primary carer to get break, even if that meant going shopping, going to have their hair done, never mind going away for a weekend or so. But I mean, these were the things that suddenly became, without day services, without respite services, carers were left 100% with the person they cared for. There was nothing there. So anything that could have funded alternative replacement care would have in itself, in this instance, been a break for carers. What's missing, of course, is anything that would be anything like organised to allow those carers to keep their employment or do something that was on their, you know, hours of work. That all's just had to stop for many of them.
In terms of Vocal as an organisation, you tell us at paragraph 18 that support is provided through telephone and face-to-face, and that counselling and group work were in-person services prior to the pandemic. How were those services delivered, or were they delivered at the outset of the pandemic?
Well, Vocal was a wee bit ahead of the game. We had quite a good digital sort of development, and we had already established, because there were always carers who found it almost impossible to leave the people they were caring for. They didn't have the time, they didn't have somebody else in the place, so they were keen to work, you know, sort of virtually. So it was phones, but we also had these. I mean, there was a gap there at the beginning, but we were pretty quick to set up video conferencing and telephone counselling, and services could be delivered remotely. And in fact, what I think I said was that we discovered that for many carers, this was easier than actually trying to make time and space for face-to-face.
That may assist your existing, I suppose, I'll call it membership. I appreciate it's not membership as such. In terms of, and I think what you'll come on to say in your statement is there was accidental carers essentially arose by virtue of the pandemic. They became carers, unpaid carers that they weren't beforehand. Now we see in your statement you mentioned that Vocal had people who would stand in public libraries and provide. How did you get the message across after the pandemic to these accidental, my own words, not I think from your own statement, but these accidental unpaid
the people
carers?
that had to be, that came forward once the pandemic was underway.
Yes.
well, obviously, the channels through other statutory agencies, GP services, etc., that stopped because people were no longer in contact. And we had to use our own media, if you like, and get out the message. Newsletters, the website, through any means, and, you know, putting up, I mean, again, all the face-to-face was impossible at certain points, so it had to be done digitally, and that was largely how we did it. And I mean, the numbers of referrals at that time, you know, it went right down, and then it began to pick up as people had these alternative ways. And also, we had many people looking for our services, so it wasn't that we had to go out and attract them in. It was that people, during the restrictive periods, were getting pretty desperate. I mean, there were young carers who didn't know where to go to get food delivered when they were told they were to stay in. There were, you know, people who wanted to do the shopping for somebody that they didn't live with, and they didn't know how to, you know, get access to the shopping slots that paid carers, for instance, got. There were a lot of services, and then later on, obviously, carers wanted PPE, they wanted test kits, and ultimately they wanted vaccines quicker. So there was a huge rise in demand that caused people to look for carer organisations.
In terms of before the pandemic, and I think we see this in your statement, you talk about the demand for carer services at paragraph 27 increased substantially, that's in paragraph 27, due to people not being able to get support through usual health and social care contacts. And you also talk about, and I think you've mentioned it already in your evidence, that the referrals through GPs had ceased. And you also identify at paragraph 32 of your statement that due to the redeployment of health and social care staff, that carer referrals to vocal dipped from about 50 a month to nil.
Yeah.
If there's more unpaid carers, but there's less referrals, were those unpaid carers relying on essentially finding you through, I think what you said is media and
Yes.
web inquiries?
Yes. Yes, I mean, word of mouth. Many people who would know other people, neighbours, friends who were in a similar caring situation. But there was that lull at the beginning when people just didn't know where to go.
Okay. We've heard from various GP witnesses. Well, I don't think we've heard yet from any of the health and social care partnerships. But do you know why they were unable to refer? Why were they redeployed?
Well, they were redeployed because the buildings-based services, like day services and respite services, stopped because of the risk of infection, and the staff were pretty quickly redeployed into the emergency services and much more COVID-related services. I mean, I know people who had phone conversations from time to time with some of the same workers. It wasn't the phones just switched off, but the snag was often the operatives who were phoning them were simply saying, "Are you okay?" And they were saying, "No, I am not. What can you do about it?" And maybe they said, "Well, you'll have to look elsewhere," but they couldn't offer anything at that point because, of course, everybody was in the dark and didn't know what was coming next.
And in terms of, I think you mentioned coalition of carers later in your statement. Other than, and I appreciate Vocal's geographically within a particular area, but are there other agencies, charities like Vocal within Scotland?
Absolutely. There's carer organisations in every partnership area across Scotland. And yes, the coalition was with the last CEO of Vocal was instrumental in getting that coalition because of which is a network across Scotland of carer organisations. And there are more than Vocal in Edinburgh. I mean, there are other care organisations, but it was trying to pull it all together, which was why in the end it became such a useful tool for the Scottish Government to go to the coalition and say, here are the regulations, please disseminate.
Okay. I'm going to come on to that. In terms of the unpaid carers and the local authorities, I appreciate you can probably only speak to two, so it's a very small sample, were the local authorities consistent in the way that they were dealing with unpaid carers during the pandemic?
Not entirely, no. I think SDS is an example of where we were aware through the coalition that there were variations in how flexible local authorities were being.
And is that self-directed funding?
Self-directed funding, yes.
And so were some local authorities approaching self-directed funding in a different way from other local authorities?
Well, to give the example of, can you use the money you've been allocated to meet the needs of your cared for person on other family members taking up the care to give you a break? Some were more flexible and allowed that more readily than others, as I understand it.
Okay. You say, as I understand it, was it something that you've heard from another party? Or?
Well, through the coalition.
Through the coalition. And the coalition of carers, they're Scotland-wide
yes.
organisation?
Yes.
You discuss at paragraph 26 the impact on fundraising, which I suppose is an issue that probably affected
yes.
many charities and such like. Did anyone step in financially to meet the shortfall?
Some funding streams were already established, so they continued, but the Scottish Government did make allowance and there were funds directed at unpaid carer organisations in order to reach unpaid carers. As I said, one example would be the carers allowance, which was to basically make sure that people had access to additional funds so that the most in need could make claims for usually food and fuel and occasionally white goods that they needed.
We talk about unpaid carers. Is there a register of unpaid carers?
No, there is not. And it's because they are not a homogenous group. Quite often, most of us in our lives will be carers at some time, possibly of elderly parents. And for many, it starts as you're just looking out for somebody and you absolutely don't see yourself as a carer. It's just what sons and daughters do. And then as needs change, or if somebody has a disability, or somebody has a stroke or major health needs, suddenly the leaning on your family member becomes more than just the regular family relationship, and then you are needed in order perhaps to do personal care, to do all the shopping, cooking, cleaning, letters and all of that, and it can build up. And it's because that doesn't necessarily happen overnight that a lot of people who I would recognise as a carer don't recognise themselves as a carer. In particular, what we see is, because 3 out of 4 carers are women, and they often simply assume that is their lot. But we need to recognise them as carers because they need support in order to sustain them and make sure they can continue in this incredibly valuable role.
Does Vocal advocate a register or similar of unpaid carers?
Well, it certainly wants to see more people sign up themselves as carers, and yes, you could say that was one of the gifts of the pandemic restrictions, that people were more likely to come forward because they were desperate. For instance, to be allowed to go on a bus to visit whoever they looked after, to be able to shop, to be able to get PPE and test kits and all sorts of things. It is really necessary to have as good a list as you can get, and I certainly see something maybe coming out of the inquiry that helps to get those lists. GPs possibly get to know carers because they're coming on behalf of the cared for person, or they come along with, but schools know all they should be on top of their list of young carers, folk that just in conversation they understand that it's a youngster who's also looking after perhaps somebody, a parent who has additional needs.
And you mentioned there the priority to testing and so forth that the carers might have. Can you explain to us the mechanics of how that would happen in practice? If someone was there's no register as such, so you don't have
No.
a membership card to show. If somebody was an unpaid carer during the pandemic, how could they get that recognition in order to achieve any priority or preference or
Well, Vocal and through the coalition worked hard with the partnerships, health and social care partnerships, to write letters so that the carer could go into a shop, could get onto a bus, could turn up at the library that was distributing PPE, whatever it was. But that's all it was. It was just a letter saying this person is known to be an unpaid carer and needs access to those services, or, you know, to be out and about without being caught.
You mentioned in paragraph 47 of your statement that the Coalition of Carers and Vocal work closely, and can you give me some examples of you working? Was it working closely or working together?
Well, all good work is partnership.
Okay.
Can
you provide us with some examples, perhaps,
well,
of the good
yes,
work?
As I understand it, the Scottish Government were really comfortable with putting down a lot of the updates on regulation to the coalition, who in turn made sure that there were bulletins and the websites kept up, so that right across Scotland the information about those regulations was relayed as quickly as it was possible to relay them, so that unpaid carers could make the necessary adjustments. At the same time, Vocal worked through the coalition to encourage all the partnerships to get some kind of carer ID for the people in their own areas.
And did carer ID, did that materialise within Midlothian?
Yes, yes.
And what was that, a badge?
That was seen, no, it was
like
a letter.
Badge that you're wearing around?
No, it was a letter with the partnership. As far as I understand it, I didn't have one, so I don't know what it looked like. But I understand it was a letter with the partnership's logo saying the above mentioned is recognised to be an unpaid carer.
And on reflection, is that something, rather than Vocal having to bear the responsibility and I suppose the administrative burden, is that something that you think could have been done at a national level by the Scottish Government or the local authorities?
Yes, I think the local authorities should know their own unpaid carers. I mean, there is legislation, there is the Carers Act from 2016 that actually suggests, more as a right of carers, that there should be an adult carer support plan or a young people's plan. So if that was followed through, and I mean, it's happening, but it's just been very slow to enact. But if more authorities had actually got those plans in place, then we would have as good as it gets, for the most complex at least, in terms of identifying who the unpaid carers are and who they're looking after. And their own needs. That's the key thing. The plans should also have reference to what those carers identify as their own needs in order to sustain them in the future.
You've talked about young carers today, and you talk about young carers in your statement. Is there a particular age group that are young carers?
Sadly, no. I was shocked when I joined the board and got some of the information, the survey figures from the past and present, to understand just how young some young carers are. They may not be doing quite so much when they're in primary school, but there are primary age children who are caring for, covering up for, supporting, and otherwise depended upon to provide care to other family members.
Full-time?
It can't be
What's
full-time.
the extent of the care?
Well, the problem is when all the services shut, even if the schools had been open, those carers, those young carers, would have had to take time off. They had to fill the gaps. Just all unpaid carers had to fill the gaps. And it is a source of alarm that even when the schools were open, or you were meant to be the kids were meant to be working digitally. If there's no services, then the people they were caring for in many cases needed them round the clock. And I think their education has taken a hammering.
At paragraph 55, you explain in your statement that pre-pandemic care services, they haven't returned to similar levels, and that's required Vocal to provide services. You also tell us that funding has been reduced for services. Can you explain, well, firstly, what types of services are you talking about? And secondly, why have they not returned to pre-pandemic levels? Is that a consequence of the pandemic?
Not entirely. The writing was already on the wall. I mean, we've had many years of austerity. We've had Brexit that choked off many of the staff who were in the system to work as paid carers. And so things were not, things were
Garden
not
wasn't
good.
rosy beforehand, but
no.
Did the pandemic have, you said not
speeded
entirely?
it up. It speeded up what was going on. And to give an example, there were people with more complex needs would be entitled to a day service, they would be entitled to respite services, they would be entitled to transport, to name three significant. They often had social workers, but everything stopped, was redeployed, refocused on COVID-directed services for the duration. And what we feel is happening is that the opportunity for many service providers has been that they simply can't afford to go back to the levels they were providing before. The assessments still stand, the people needing the care are still there, but the funding simply is no longer available. So day services have never, as I understand it, gone back to the level they were at. I know families where they are getting half days or fewer than full time in terms of a day service. They may or may not have any respite or replacement care services, and transport is now, it's been sort of broken away. It used to be an automatic that if you were awarded a day service, then you obviously needed to have transport to and from, and now you have to go through a separate panel in order to get that. And again, it's all driven by finance. It's all driven by the fact that the partnership would love to deliver what it used to deliver. Possibly, yes, they saw ways that they could redesign services and make them more efficient, more effective, more targeted, whatever. But the bottom line is the funding is simply not there. So people who were assessed as needing these services simply do not get them any longer.
In terms of transport, and we've jumped forward and I'll come back,
Sorry.
But you mentioned, no, that's quite all right. Helps the flow. You mentioned in paragraph 71, you discussed issues about whether transport was included in funding, and you identified that there were difficulties. Can you explain to us what you mean by transport and funding being interlinked?
Well, if you have a child with additional support needs going to a special school, it was taken as read that you would, if your child couldn't just walk to school, or of course a special school maybe half a city away. So transport was just built into that. For adult services, it was broadly the same, that if you had a day service and it was in a building and it was half a city away, there would be transport. Already they had tried to unpick that, and it was becoming a service only really available to the people with the most complex needs who absolutely couldn't use public transport, didn't have a mobility vehicle and driver to hand, etc. But what's happened is now that the transport is just like a separate service, so it's not tied in the way it used to be. It's something you have to apply to. So you can be told you've got 3 days at a day centre, but you'll be left to sort out the transport. You can apply for a transport, but it's not a given the way it once was.
Is that as a consequence of the pandemic?
Who knows? These things just all speeded up. They fell during COVID and they were not reinstated afterwards.
Okay. And at paragraph 56, you identify that the Scottish Government, you say, whilst we celebrate the Scottish Government for funding unpaid carers, especially those carers in financial hardship, we say that funding for service delivery for those being cared for has shrunk so much that there's more work for unpaid carers to do to fill the gaps. You talked about and you go on at paragraph 58 to say that a lot of the available services were not available and that people were emotionally stressed. In terms of the impacts on the physical and mental health, was that affecting the unpaid carers and the people they were caring for, or just one particular?
No, it would have affected the people they were caring for. Many people who had services, it was their social life, it was their life to leave the house on a daily basis like the rest of us going to work. They would go out maybe to a day centre, they would meet their friends at that day centre, etc. And they were undoubtedly stressed when that all stopped, and then has not largely, for many, it's not gone back to the level it was. But for the carer, they were left filling the gap, and that filling the gap has huge ramifications in terms of that additional workload that they would be doing, the caring work itself. It was very stressful, but one of the key things that we're seeing increasingly is it's pushing them out of employment. You know that they're not allowed, if they get carers allowance, and only 1 in 4 earns so little or nothing that they can get carers allowance. But for the people who are trying to hold on, whether for their sanity, for their financial well-being, to work, which the rest of us just take for granted, they are being pushed out, because the less service is provided for the people they care for, the more they have to take on, and they can't do it all, and they are being forced out of work. And one of the ways that this is now happening is there's a conflation between the partnership's approach to short breaks and services, so that if you're the person,
when you say partnerships, health
and social care partnership, if the health and social care partnership say, right, we'll give your looked after person a day service, now mark this, that's your respite, that's your short break. But that doesn't necessarily fit with the working hours you do or anything else. And you're good. Anyway, it's just that conflation has made things a lot worse. You're not getting seen in your own right as having your own needs. And that's what the Carers Act promised, that it would put the carer into the position that they were recognised as a partner in the care of the cared for, that they would get an assessment of their own needs, and that there would be services to support them.
In terms of employment, and you identify at paragraph 79 that 1/3 of carers required to give up work due to caring responsibilities, and that 4 out of 5 carers are women. In your statement, are you referring to people having to give up work as a consequence of the pandemic?
Unpaid carers in greater numbers have had to give up work, certainly during the pandemic, because there were no services for the cared for, so they had to just stop what they were doing. It was okay if they were in the sort of jobs that were furloughed or sort of stopped themselves. But for many unpaid carers on the lowest levels of pay, temporary contracts, etc., etc., they were the ones who were doing public-facing jobs in many cases. And, of course, they couldn't take the risk. They either was a health risk or the times, they just couldn't get the cover to do the work.
Those those carers who gave up their employment to become as this kind of accidental carers, if you like, as a consequence of the pandemic, do you know if they've now returned to work?
No. I'm pretty sure, because the figures are still showing the sort of survey, and then the carers that are coming to Vocal now. It is a growing concern. More people are coming through the door now saying, I need some support, I need some help. Tell me how I'm going to manage this, because the less my cared for person gets by way of statutory services, I can't juggle my working hours and their care needs.
Okay. Going back to paragraph 66, you tell us about of your statement, you tell us about the difficulties in unpaid carers obtaining personal protective equipment, yes, PPE, in the initial stages of the pandemic. Where were unpaid carers obtaining PPE in early 2020?
Well, they didn't have, I mean, it took until there was, they could get accreditation. I mean, if they were, I'm trying to think, I know somebody who got stuff through a library, and I think they had got, because they were recognised or known to be carers. But if you didn't have a carers allowance, for instance, that proved you were a carer, you couldn't get stuff.
You used the word accreditation there. Is that a
Sorry,
reference to the letter?
It goes back to the letter.
Yeah, it goes back to the letter.
Identification as a carer.
If you had that identification as a letter, did that open some door to PPE?
Yes.
What door did it open?
It meant you could go and you could get some without paying for it. Because in the early stages, they just, well, as I say, I think there were medical establishments that opened their doors to unpaid carers. And the same with test kits. All of that kind of practical help became available in communities.
So essentially this letter was a kind of golden ticket to essentially PPE.
Essential materials to keep people safe. Houses, people's homes became like mini care homes. Everybody having to be terribly careful and gowned up and all the rest of it. But, you were talking about some of the most vulnerable people in the city.
At paragraph 69, you tell us that the changes in the regulations were confusing and contradictory. When you say that the regulations, are you talking about the lockdown restrictions?
Yes. Yes.
And did Vocal or did other unpaid carer organisations raise this with the Scottish Government?
Oh yes, I mean I think there was communication, whether directly or more likely through the coalition, to say, some of the chopping and changing, well, remembering back, it was sometimes very difficult. The bubble system was confusing because so many carers have more than one person they're looking out for. Many of them were child carers for, their kids, and also had either their partners or elderly parents or whatever. So quite often they ended up in a confusing situation because of the different bubbles.
Raising the contradictory statements, if you like,
yes.
did that cause anything to change? Was there clarity brought by the Scottish Government?
It was more that we started. There was a development of the relationship, and as I understand it, the coalition could better answer that and say whether they felt that it was quicker, slicker, and they got direct information as and when. I know that everybody tried to get their websites clear and as much information as possible. That was as good as it got.
Okay. At paragraph 72, you say that people who were hard to reach are now even harder to reach, such as refugees, single parents, and people whose first language is not English. When you talk about people who were hard to reach are now harder to reach, was that the pandemic that caused that?
Again, I think it speeded things up. I mean, during the pandemic, there were a lot of people who either didn't recognise themselves to be carers, or all of these groups who were, the communication issues were major, and the minute you go on to digital, some people are not don't have digital access, or it's all given out in English and it's a bit more effort if you need it in another language, or you're just struggling on the day-to-day and you don't have the energy to seek it out if it's not in your face. So anybody for whom life was just complicated, complex, they were at a distance from the information. So it did become harder.
What could have been done differently?
Well, all the access arrangements that we know about might have been there, but that takes a bit of funding. I mean, to make sure everything's really accessible, you have to put specific funds into that. I mean, good partnerships were formed. It wasn't that it stayed in that state. And a lot of work, I mean, for instance, I know that for the distribution of carer support funding, we did a lot of work through partnerships, for instance, in order to reach these key groups. But again, it's all another layer of administration, and so most things can be eased with better communication and eased with funding.
Okay, thank you. Paragraph 73 of your statement, you discuss the carers surveys undertaken in 2021. What was the purpose of that survey?
We do these surveys every 2 years in order to get a very accurate picture of where carers are up to. Obviously, it's a sample size, but I'm told by the independent group that do the surveys that it's a reasonable and therefore robust sample size. I know you could question it and say, on the one hand, well, who's going to fill that out except the angry? But you could also say that the exhausted won't be filling it out either. So you have to hope that you get a representative sample, and every 2 years, which is why we only do it every 2 years, but it's to get the most up-to-date and accurate information about exactly what is happening for different groups of carers. And we do it by questionnaire, small group sessions, one-to-one, and it is done by an organisation that's independent of Vocal.
And I think that survey you identified, paragraph 74, showed a 20% increase in carers reporting an impact on their mental health.
Absolutely.
And I mean, I suppose just if there's been an increase in carers, does it necessarily flow that there's, or how do you know from the sample size that that is directly proportionate? If you've got greater numbers, is it the 20% of everyone that responds?
I would suggest that it's an indication of a direction of travel, that people are getting more stressed, more stretched, their mental health is suffering, and this is again reported. It's consistent with the day-to-day reports we get from the carer support practitioners in Vocal, who are seeing more and more people coming through the door who are in a more critical state with more complex needs and in a worse mental health position. And you can understand that fits with all the medical evidence that says people sat in things during COVID, hoping that after COVID they could return, but by that time symptoms had got worse. Everything's got worse. Sorry, I mean, it's not all COVID, but there has been a worsening of the state that unpaid carers find themselves in.
And dealing, you mentioned this earlier, unpaid young carers. And you deal with this at paragraph 82 of your statement, and you state that they've lost, excuse me, education that they'll never be able to make up. Do you have any rough estimates of the numbers of young carers? I appreciate it would just be within Midlothian and the city of Edinburgh.
I wouldn't like to take that risk of reeling off the numbers. Again, it's an area that we need to be a lot clearer. You know, we need to be working more closely with schools. And of course, in the city, for instance, the partnership is only adult services, but we are going to need to, moving forward, be more careful about working more closely with schools. Getting it right for every child should mean that schools know their kids and know which children are carrying caring responsibilities.
Towards the end of your statement, at paragraph 87, you start to talk about the financial impacts, and you highlight that carers were affected disproportionately, as many were in benefits or low-paid jobs and have higher costs. I suppose that's proportionately in terms of heating, and may not have access to digital services. Is there anything that you think that could have been done differently that would have alleviated the pressure, if you like, on unpaid carers?
I think it comes back to knowing the people and what their needs are. And the mechanism for that starts with the adult carer support plan. Because if those carers were asked, what are your needs? They might better say, well, I have health needs of my own. I have a great financial burden because the person I'm looking after needs the heating on all the time, and I do loads of washing because they're not continent, etc., etc. So the best thing to do is to start with the carer and complete these adult carer support plans and the young people's plans, and that way you'd get a much fuller picture. The Health and Social Care Partnership would have a much fuller picture of what they then needed to respond to. And yes, then I would like to think that some services or funding or whatever is required goes in. And it doesn't need to always just be money. It can be networks of support. And I know there's lots of voluntary organisations are more than happy to work in partnership to help get networks of support.
Can I, in the remaining 5-10 minutes that we have, I wonder if I can go back and ask you some questions, again, without using his name, about your son, sure, and perhaps what might be regarded as a success story in terms of the establishment that he was residing in, at least during part of the pandemic. And I wonder if you could turn back to paragraph 12 of your statement. And maybe just, I suppose, to speed up the process, you tell us your son's now 30 and he lives in a Camp Hill community. What is a Camp Hill community in brief terms?
Camp Hill communities are based on the work of Rudolf Steiner. You can take him or leave him, but the bottom line is they run these communities that are based on a life where every individual's valued, where every individual is seen to be worthy of investment, where basically they both have houses that are meant to be small units, they're homes, but they also, and this is critical, is they also have day activities, workshops, where that's their contribution. So there's a real encouragement of the model of you live somewhere and you work somewhere. And sadly, that's what's missing in other services.
We've heard, tail end of last year, we've heard a lot of evidence in relation to difficulties visiting care homes and so forth. I'm wondering, what was your experience of visiting your son at the Camp Hill community?
Well, because he's fit and active, he just has a whacking great learning difficulty and autism. We were able to see him outdoors, and they provided test kits, and we had to do the test on the spot. So we had to be clean and clear. We had to be, and they provided that location. And literally, we met on the boundary of the estate where he lives. And as long as we were just socially distanced, walking out over the hills, we could see him. And that made a huge difference, because the people who were in care homes and the people who had end-of-life care reduced to seeing their loved one an hour a day in the last days of that person's life. I mean, we had it easy. I'm well aware that because he was fit and healthy, compared with people in different circumstances where folk were not as well.
You talk about being outside. If you
Yes.
wanted to visit inside in inclement weather, that wasn't...
No. You had to take your luck with the Scottish weather.
Okay.
No, the Care Inspectorate were very, very clear, and I have to say they gave very clear guidelines to organisations, care homes. At least that was my experience with him. I know that it was different with other care homes, and particularly with hospices.
Do you know if you're talking about testing, do you know if the residents were being tested?
Oh yes, 3 times a week.
Right. And what about the staff? Do you know?
Same.
Okay.
That was a success. They had visiting testers who came every 2 or 3 days and did that. Because when I got COVID and I'd seen my son, he ended up being put into isolation, which must have driven him nuts and been very hard. But they were able to get 3 clears off him within, I think, 5 or 6 days, which meant that his confinement was reduced to just 6 days.
I have no further questions for you, Ms. Hendery, but if there's anything you think that would be useful to the inquiry, this is your opportunity, or anything you think that I perhaps should have touched on within your statement, which is evidence before the inquiry, this is an opportunity for you to identify.
I suppose that last point, I'm so relieved that my son was in an establishment where after the beginning, there were times when we couldn't, there were months when we didn't see him, but that we were eventually able to, because he is autistic and he doesn't understand, and it was horrible. But I think I have to make a plea for the people who could not see their loved ones. And I know people personally who, at end of life, that was wicked and cruel that they were not given even the same allowance, or even to sit in a room for more than an hour with the person that they knew they were losing. And I do think that was particularly hard, and I would have to say, I think more flexibility should have come. And I can't but add as the last thing, it did not, I don't know if you'd ever be able to enact those restrictions in any form again, not after we saw what was going on in Westminster.
I'm sure they're grateful for those touching words. It just takes for me to say thank you very much for not only being here today, but taking the time to obviously prepare such a detailed statement, the evidence of which is before the inquiry. My Lord, I have no further questions for this witness, and it's the only witness for today.
Thank you, Mr. Dunlop, and thank you, Miss Henry. I'm very grateful. We're starting at 9:30 tomorrow, Mr. Dunlop, I'm afraid.
I'll pass that on to Mr. Gale. I'm grateful, my lad.
That's all.
Thank you.
Thank you very much.